welcome and thank you for coming. I'm so delighted that you are here, and very, very happy to introduce Dr. Amy Haddad to you. Dr. Haddad is a Professor Emerita at Creighton University, and this is sort of the context in which I have known her for many years is her work in bioethics. She was the director of their bioethics program for many years and is also a nurse and a nurse educator and a poet. She holds an MFA and is here to share some of her poetry today. We are just delighted to have you, and I want to make sure that I thank the Humanities Institute, who has helped to support this event with a grant from the National Endowment for the Humanities. And so together with the Humanities Institute, the Center for Bioethics, Health and Society is happy to welcome you. There is some information on the little tables. There's postcards about two of Amy Haddad's collections. One is a chapbook, and the other is her collection of poetry, An Otherwise Healthy Woman, from which she will be reading today. So welcome and thank you so much for being with us.
Thank you, Anna, very much, and thank you all for being here. It's always lovely to have an audience for this. I'm going to read from the collection, and it's divided into 3 parts. And the sections deal with different facets of my life, and I think the lives of lots of all of us, actually, and for those who are health professionals, even more so. The first part of the book deals with family caregivers and what that's like to take care of members of our own families, either as daughter, wife, mother, father, brother. And then the second section is about being a health professional, and the third section is about being a patient. So from those 3 perspectives, and some of the poems could slip in and out of different parts of the book, and as you listen to these, I'll kind of head up each section so you can kind of hear. I don't do a whole lot of explaining, but sometimes I'm inspired to do that. So I like to have the work speak for itself, but sometimes it's interesting just to add a few highlights. So the first section of the book is titled, In the Clutch of a Rubber Band. And the first poem I'm going to read from that section is called Making Camp. The hall to intensive care is always lit. At night, families and others, unprepared, no gear or supplies, make camp in the waiting rooms, retreat to corners, arrange makeshift pillow forts, lay claim to sofas, drape and shape with sheets to draw property lines. Downstream, the more private consultation room sleeps too, but reeks of bad news. The tinny heave of the coffee machine marks time over the family burrowed under the information desk. They stay close in case something changes, hover at the end of the bed 10 minutes every hour. At dawn, they bend, stiff and rumpled at the sinks, splash water on their faces, avoiding any glimpses of their mirrored lives, then pat dry with harsh paper towels. They lean against walls to get the best signal, texting, talking, and casing out who might still be there. The next poem is titled Flexion Extension. I will say about this, and several of the other pieces, I'm fascinated with language in healthcare. It's just such a unique use of words, and the idea of flexing and extending anything. In this case, the poem talks about hands. The hospital bed fills the small room, forcing the dresser out in the hallway. I sit sewing buttons on clothes I never wear, hate mending, but my hands need to be busy, a mindless task while I watch my dad. The bed, a huge metallic insect stuck on the pink hooked rugs of my parents' room, holds my father up so he can breathe. I watch him out of the corner of my eye. His chest rises erratically and falls. He stares up at the ceiling, slowly opens, then closes his left hand over and over, cupping my hand over his soft hand that labored in music and contracts. Dad, you okay? He nods, and as soon as I take up my sewing, he picks up the rhythm again. Open, close, open, close. I have seen other patients do this sometimes, gathering up the sheet as they do, absently, not urgently, collecting, releasing. The next poem deals with something that maybe some of you have been through. When usually an elderly person is in a skilled care facility and they are being considered to go home, someone on the team, the rehab team, goes to the home and checks to see if it's safe for the person to go home. So it's called a home assessment. And when I first read the title, someone thought I was talking about like when you're selling your house. It's not that kind of home assessment. So just to set the stage, home assessment. Through the eyes of a stranger, the house looks its age with blue siding and peeling windowsills. The therapist counts the stairs into my mother's home, my home where I grew up. There is no railing by the steps. Mom demonstrates she can walk up without a railing. My brother and I follow, looking down, ashamed somehow by our lack of foresight. Something about the autumn light seems to coat each room with a veneer of pale egg yolk. The therapist frowns at the throw rugs, the distance from the door to the kitchen, the height of the toilet seat. She moves Mom's nightstand, shoves the dresser to the opposite wall, something I would dare not do. The therapist plops the phone in a new spot. My mom performs tricks on command, like an ancient dog in a bad circus act. She makes it into the tiny bathroom with her walker, turns around slowly on her hind legs, and sits on the closed toilet. She steps not once, but twice, in and out of the shower, using the sink and walls for balance. At least there is a shower chair to protect us from total failure. The therapist warns about oxygen, clear space for a concentrator big as a dishwasher. We must have backup portable tanks in case of a power outage. Someone must be there to crack the tanks and hook Mom up so she can breathe. My brother and I exchange looks of terror. The therapist moves from room to room, measuring the miles of oxygen tubing Mom needs that trail from her nose and drag on the floor. Nothing else matters to Mom but to get home. We would agree to any measure to make her safe in their eyes, to get their permission for her to return home. Something about the light on our way out calls forth a memory of a yellowing photograph of my brother and me seated on the fireplace hearth in the oak-paneled family room. I'm holding his hand. He looks up at me, only 2 years old or so, his big sister. The clock on the mantel says 5:30. Everything in the room is new, in its place. The still life print overhead, carriage lamp and copper kettle. Our mom behind the camera. From the motel window. Brake lights bleed on the gray snow as cars and buses move in and out of the teeming parking lot. Healthy and young, students and coaches trudge to the stadium entrance. A swim meet, the sign says. Their breath hangs in misty clouds over their heads. She stares down from the motel window while the tiny phone delivers crushing news. Every detail of the scene below is burned in her mind. She hears the words, all bad, tests inconclusive, multi-system failure, may not survive the night. but her attention is on the dirty snow, the cold she cannot feel, and the silence in the room. She pulls the curtains behind her and leans closer to the window, looking down, trying to listen. The grave voice on the phone asks about next steps. She knows there are none, merely laying the groundwork for death. She is trapped here, not where she should be. Forever she will think, this is what grief looks like. Frozen on the other side of a transparent wall where you can see others move and breathe, but you cannot hear what they say or feel the cold on your face and in your throat. The next poem has to do with my husband. And I'll tell the backstory, and the poem will make a little more sense. He was in the mudroom area of the house, and all I heard was a curse coming from him because he had come up and he had opened a cupboard up above and forgot and came up and hit the top of his head. And I said, what happened? And he goes, nothing, I hit my head. Go forward a month, and all of a sudden, we are in the emergency room because he had a traumatic brain injury from that little hit on the head with the counter. So this was the first time that I was in the role of the caregiver in our marriage. He had been caregiver for me, unfortunately, frequently, and now I'm on the other end of it. So he's in the neurointensive care unit at the Academic Medical Center, and both of us are nurses. My husband's a nurse too, and we were completely at sea. So this is called my role as the wife. I'm the wife. My name is written on the whiteboard in his room between the date and the nurse's name that changes every 12 hours. I am a permanent member of the company. My most frequent line is, I am the wife, not I am his wife. The possessive pronoun is lost under the hospital bed with his shoes. My part varies little from day to day. My husband speaks off script. He talks about angels and other visions, except when he has a seizure. Either way, interrupting or convulsing, he is ignored by the rest of the cast. I cheat and write notes on my palms. Sometimes I read right from the page. I memorize the lead physician's lines, then repeat them to each fresh team. We should work from the same script. Even so, the other actors have new pages every day that I do not see. I must improvise. The director loves spontaneity. Just go with it, he whispers from the wings. My blocking is uninspired. Mostly, I stand by the bed where my husband lies. When the call-out is on, I cross downstage to the door, looking for help, waiting for a nurse to pick up the cue. My final scene is full of cliches, empty reassurances, backward glances. I kiss his hot forehead, whisper goodbye, start out by drug carts and dirty linens, then turn back into his room to secure a parting promise from the night nurse. Call me if anything changes. I have one more line. I mean it, I say with feeling every night. The nurses nod, but never call. I am a bit player. What I say does not drive the plot. I exit to the elevator, barely taking the road on my drive home. The bed, like the house, is empty. And now we're going to move on to what we did on the floor, which is the second section of the book. And this is from the perspective of my role as a nurse. And we used to talk about working on the floor, so that's where that title came from. And also from a wonderful poem, a line by Marie Howe, so I borrowed that from her. Second degree block. For more than 3 decades, I have saved the fine etching of your dying in a recipe box, where I kept 3x5 cards on which I painstakingly printed words like antiarrhythmic and cardiotonic. I used the cards to tell my instructor about the drugs I would give and why, even though I didn't really know. The EKG strips are pale green graph ribbons clipped to the drug card for digoxin, to slow and strengthen the heart. I have underlined these words. The problem was with conduction, not the muscle, I see now. The electrical circuits of your heart were faulty, like old stripped wires. The message haphazardly getting through to the ventricles as the spaces between the spidery spikes grew wider. As we stared at the bank of monitors in the nurse's station, I only had eyes for the one labeled Room 4. When your heart misfired, I froze the screen and hit the print button. I learned to measure the length of your failure with a ruler, to place tiny, precise marks between the QRS peaks and valleys and the roll of the T wave. Dutifully, I counted the minuscule squares, noted the times on the back of the strips. Each hour, the rhythm a little worse. I took them home to practice measuring, never tracing them back to you. When you're a health professional, you cannot help but see things in the world through those eyes and ears and other senses, right? And so you can't turn it off. And I've always thought that was an interesting thing about being a health professional, that it becomes part of you, and you don't even notice it in the way that you're leading your life. So this poem is called 10 Items or Less. I can spot them even in the checkout line. Putting the rubber stick between their oranges and my bread, I see hands, marked with purple, green, and yellow bruises. I know where they have been. The needle stick's just the start of it. The bruised tattoos, each prick leaving its history. I match the hand to the face, looking for signs of what is killing them, as they sort coupons for cereal or canned tomatoes. Of all of the poems in this part, I think this one came from, I'll use the term amalgamation, of working with families around end-of-life issues in my work on the ethics consultation team. And if you ask ethics consultants, people on the team, what sorts of issues they deal with most often, they are almost always around end-of-life issues and questions of withdrawing treatment or discontinuing treatment. So with that kind of in the back of your mind, as I read this, you can think about what the poem is saying. Families like this speak too loudly, stink from sweat and beer, thrown together like strings of Christmas lights jammed in a bin where some work and some don't. Jessamine's mine, the mother explains. Lonnie's ours. Families like this carry pocket knives in their overalls, use one to cut down their boy from the swing set where he hung in the rain, lay his body on the slide, wait for the squad. It was raining that day, or we wouldn't never have looked out the window, never would have found him at all. It was raining. They repeat the story to the flock in the waiting room. Families like this are wary and watchful, agree to every test and treatment, never ask the health team questions, only nod. Families like this worship before the heart monitor, spy miracles in each muscle twitch or sigh from the ventilator. But this family doesn't believe in our religion. This family watches their son, turns their backs to the heart rate skimming across the screen, not taken in by this false God. After only 2 days in the ICU, the mother tells the team he is gone. Stolid, clear-eyed, This family has drawn a line. Too soon for us, the team fights for him. He is so young. We shift to high code to murmur about their survivor guilt and premature closure. The family circles the bed, his stringy black hair stark against the pillow, his teenage whiskers dust. They wait for the team to get it, willing us to stop. Not what we expect from families like this. And the last section is my experiences as a patient. I'm always uncomfortable writing in first person, so sometimes I write in second person and third person voice just to see if I can put a little distance between what's happening, because some things are so close to the bone that it's difficult. And also, when you put things in first person and people think that this is exactly what your experience is, it's very difficult to get any good criticism of your work, because then it becomes a criticism of you and your experience and the truth of it. So you'll see me switch voice in this, and that's one of the reasons why. So this section is called Cut Along the Lines, and I'm actually going to read the poem that has it as a title. Again, for those who may not know this poem is called Portacath. Portacath is a commercial name for a venous port that they put for cancer patients to get their chemo, so that they can get it into a large vessel and not risk damaging more peripheral veins. So it is an outpatient surgical procedure. They put it under the skin, and then you have an access that's then consequently sterile because it's underneath the skin, so they clean it off and then they put a large bore needle in and away you go. So there's an efficiency with it. I will just say that I particularly detested this when I had it in. Nobody asked me where they were going to place it. That seems like a small thing when you're trying to figure out about chemo and surgery and all of that. But where they place it makes a difference with where it shows. Because eventually one day, hopefully, you will not have it for the rest of your life. And so this poem is about that. It's called Portacath. Button made of skin, easy access to my veins. Easy as a whore, blank-eyed and indifferent, opening to the syringe. When chemo is through, I asked to have it removed. The silver scar stays, peeking out above my bra, shining at dinner parties. The next poem is titled Before and After Breasts. In a place where every woman who waits is in pain, the chairs are wooden and hard. The plastic surgeons hire only beautiful receptionists who wear pink smocks to show off their tasteful cleavage. I await dismemberment and reconstruction. No choice about losing my breasts, some choice about what I could do to hide my loss. Too weak or proud for a flat chest in the judgment of strangers. I pass the time before my appointment with a photo album placed in my lap by a young woman in pink who gets to keep her breasts. I've seen this kind of book in pricey salons, a portfolio of the master's work of lovely models with exquisite haircuts. This book is filled with headless women, hands on hips, cut off at the navel, paired up as before and after photos of breasts, pages of breasts. The before breasts droop in the way breasts do that have been used for food and lovemaking, breasts that give to the pull of time. The after breasts look startled, at attention, and always bigger than the before breasts. Think of this as an opportunity to have the breast you've always wanted, the plastic surgeon pitches to me. a used car salesman. He examines my trade-ins, their wear and tear, mismatched size, and memories. Cut along the lines. After hours of signing consents, I am finally ready to go under the knife. A sedative blurs the world. I drift away, but someone pulls me upright, unties my gown, lets it fall to my waist. I feel a marker drawing on my bare chest. I hear it squeak across my skin. I see a bold yes on my left breast. Groggy, weak, limp, I reason, oh, they want to make sure they cut off the right one. The drawing tails under my left arm, charting how to divide me, where to dissect my latissimus dorsi from its origin in my back to cobble a breast. The surgeon draws letters, arrows, and dashes, a cut diagram like those made for butchering steers. Chuck, dash, 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 sits next to ribs, dash, 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 above brisket. They mark the primal cut to save precious muscle. No one warned me this would happen, the drawing. No one told me my body would be used as a whiteboard of reminders for the surgeon. They don't have to tell me these minor details. I will not die from the markup. But I retain the permanence of the black ink. Does everyone know what a cut diagram is? Do you know what I'm talking about? Have you ever seen a cow? They draw a cow and then they draw where they do this. And the primal cut is important for the cow, the steer, cow, you can tell I come from Nebraska and I don't know what to call a cattle. Primal cut is important because if you cut the steer the wrong way, you waste good cuts of meat, so it makes it less valuable. And in surgery, you're doing this because if you don't cut in the right place, you're not going to have enough to do what you want to do either. Anyhow, I was fascinated with that. I had to look at all those models. There's a lot of those out there on the internet you can see if you want for a little visual on that one. This next one is called New to the Joint. We old hands curl back in our recliners like crabs tucked into a vacant shell. Our bodies are here, but our minds float fuzzy with sedatives and chemo. The air changes, fills with a scent of soap and vanilla. Someone new takes the empty chair in our corner. We watch the novice drop purse and phone by her seat. The beads on her wrist clatter when they start her IV. She asks, "What do you have?" She breaks rule 1. Never ask what you're in for. Yet, breast, breast, lung, we say in rhythmic order. Emboldened, she shatters rule 2, tells us her secret crime. I have a big old tumor around my aorta, her voice full of shy hope. We try to control the soft whines in our throats we dare not share, for we are beaten dogs. We know she is on death row. If our chairs were not made of lead, we would push back from her flimsy hold on life. We will not steal her innocence. We fold away into ourselves. So the setting for that, because it doesn't often come across here, but the way that I receive chemo, I've written another poem called Chemotherapy Lounge, because they had recliner chairs in a group of like 4 people. And so you get to sit and watch everybody else get their chemotherapy while you're getting your chemotherapy. And I'll tell you a funny story because it's been very dark, so this will lighten it a little bit. Something that happens when you're on chemotherapy, particularly, oh, God, I want to say erythromycin. I can't remember the one now. It's a horrible one. It makes your urine turn like fuchsia. I'll think of it later on. Anyhow, sometimes you get nauseated and you just vomit like that. I mean, just you don't have any warning or anything. So here you are getting chemotherapy with strangers in their chairs getting chemotherapy, and then you throw up. So it's like grade school all over again. Because if you throw up, then somebody else throws up. So it's a big mess, and everybody's very unhappy about the whole thing. To add insult to injury, my wig that I had on at the time, why I thought I needed to wear it to chemotherapy, but that'll show you something about your own sense of who you are. My wig went into where I had thrown up, so now I couldn't wear my wig, and they gave me scrubs to put on because I'd thrown up on myself. This is nurse stuff, so just, those aren't in healthcare, this happens, right? And they were kind and they were fine with all of that, and it was as if it had never happened. I mean, so when I went out afterwards, I'm carrying my soiled clothes and my wig in my bag, and I have to stop at the desk to make my appointment for my next visit back. And the woman at the desk, who all she does is the scheduling stuff, she's looking down and I'm saying, I'm Amy Haddad and I need to make my next appointment. And she looks up and she said, "What the hell happened to you?" And I always remember that as being the kindest thing that anyone did, because she just recognized this is not normal situation to go through. And it reminds me about that part of all of this, that sometimes what you want is someone else to just say, this is awful. But it's really hard as health professionals to say that to somebody because you feel like you need to fix it. And also, you're the cause of it in an indirect sort of way that's trying to help. Very odd scenario. The last poem is a little lighter. And it's called Bottom of the Cup. This is a real place in New Orleans. There is a tea parlor in New Orleans where they serve tea, and they will actually do tea leaf readings and palm readings and all of that. So you can go in, you can have tea, and then you can have your fortune told. So it's called Bottom of the Cup. The shop still serves tea, but I am here for the psychics, to peer into my future, a place no one I know will see me go, a few blocks off Jackson Square. I asked for the whole deal, a private booth like a confessional, tarot and palm readings, and an audio recording to replay later. I pull aside the velvet curtain, limp with heat and humidity, sit, listen to the snap of the cards and murmurs through the thin walls on either side. My diviner appears in an orange silk shirt, ratty at the cuffs, and the kindest eyes that ever held mine. Lined and weather-worn, a slight tremor in his hands. He says he quit teaching long ago, has the gift like his mother. Best to use it. After setting up the recorder, he clears his throat and asks, "Cher, what do you want to know?" I planned to say nothing of my hopes and fears to test what he could see, but something breaks in me. He traces the lines of my life and tells me, "There are menacing clouds in your future." This I know is true. These dark times will pass, so don't worry, Cher. I see a long life and love. I don't believe him, but he repeats it even so. I see love. And that's the end of my scheduled reading. Sure. We have time? Yeah, I mean, if anybody has any questions, I'd be happy to. Don't be shy. Yes.
Yeah, I guess I was just curious why you chose to write on, I guess, the darker themes associated with healthcare. I mean, whenever I think about it, I usually think of more of like the loving atmosphere that kind of surrounds all of the darker things. But I was just curious why you focused.
In what section or just the whole thing?
Well, I guess the one I'm thinking of in particular is the very first one where you're writing on, the family being present there and like how uncomfortable it is for them to go through that situation. But of course, they're there from a loving perspective. I just thought it was an interesting way to frame it. I guess my question was, why did you focus on the more darker theme?
I think, okay, I'll say this. Before I was a patient, I thought I was a really, really good nurse. Before I had to take care of parents or my husband, I thought other people were really good at what they did too. So to see the other side of it and to feel so helpless when I know so much about this struck me as something that needed to be brought more to light. And so since I have that kind of witness role of kind of both sides of the thing, I thought it was important to, if you're one of the few people who might have this perspective on something, maybe it's a good thing to try and write about it. And probably naively, but hopefully, if somebody reads this that isn't in a position to work with families in this way, that they might pay a different attention to what's going on. And I think what's routine for health professionals is not routine for patients or family. And we forget that because it's what we do every day. And so maybe just a moment to kind of step back and say, pay attention to these things, because for all these other people, this is not business as usual, and you're probably seeing people at the worst moments in their lives. And so as hard as it is on you to do your job, it's even harder for them. That sounds very preachy. I'm trying to do that by not doing what I just did, right? Because if I gave a talk and said, okay, you should all do this, I want to see if the creativity in the poem and the different images of the poem can suggest those things to people, but not be so dogmatic. Yes?
How did you get into writing poetry, which is like just that book?
Yeah, the old story, like in grade school. I have some old poems of mine about the Easter Bunny and things like that. And I had, in my high school education, we were very encouraged to do lots of things in the arts, so I liked theater and I liked writing, and I would sit and rewrite. We were talking about Shakespeare earlier. I had memorized some of the speeches and I'd rewrite them just to think like, this is what Shakespeare wrote on it. And then in college I did a little writing, but not much. And I was a nursing major and there's not a whole lot of time to do other things. So after a while, when I was teaching nursing, I got interested in doing more writing, becoming a patient. I wanted to write about that, didn't quite know how. So I would go to workshops that were like a weekend long and sometimes a week long, and I'd move some poems forward, but not very far. I just didn't have the time. So really, I waited until retirement to get an MFA and actually go and learn about craft. And so I'm a real newbie to this in any sense of the word. So it's never too late if you want to do something and learn about it in your life. I'm learning all the time. It's very humbling to learn when you're older, because you feel like, well, I know a lot of things and I don't about this. And so when I do things now that are purposeful, I might have done them before accidentally in my writing, but now I know more how to make certain things happen. And if you go back through and look at some of what I've read, there's alliteration, there's extended metaphors. So there's all these things I didn't have a name for. I kind of knew some of those things from English way back when, but here's an idea. Now I know how to use them and use that. So all along really, but seriously, just in the recent past. Yes?
Amy, I wonder if your work as a clinical ethics consultant has influenced your poetry. Do you think it has? I mean, I heard a hint in one or two of the poems of ethical issues.
I think sometimes it's probably more there than I realize it is. I mean, like Anna and I were talking earlier about in Cut Along the Lines. She said, well, that's an issue around consent. I would use this if I was having a discussion around consent. And what do you need to tell somebody or what don't you need to tell them? So I think if I went back through and read it more with that eye, but I think generally, besides families like this, which is very much about how often we ran into that, and people actually use that phrase. I mean, they do. We talk about patients in families in terrible ways.
Yeah, that's the one that struck me.
Yeah, when you think no one else is going to hear it, I mean, that's how you talk. So anyhow, yeah. but not consciously, you know. I mean, again, because I don't want it to be like, here's the lesson, if I can help that. Yeah. Yes. You had your hand up before.
Oh, I had a very similar question, but how did your background in nursing affect your perspective of bioethics and poetry?
I was saying in a class earlier today that one of the things that I think I've been interested in writing about is that as I reflect back on what I was doing and what I knew and what I didn't know, and that as you develop expertise in your field and stuff, you sometimes forget your novice self and what you were doing and what you were faced with and expected to be able to deal with without maybe the right tools or things to really do that. So I think nursing brings you very, very close, like I said before, with people in very bad situations, very vulnerable. And I want to say this, but I don't know that it's true anymore, so that kind of makes me sad. I was going to say that beyond the care we give to children as parents, and the intimacy of lovers, nurses used to be the ones that were doing all of these things that maybe you wouldn't even let your spouse be the one to clean you up if you needed that. Do you know what I mean? That intimate moment that you're doing things to people for their own good, helping them do things that they can't do for themselves, and then they're humiliated about that. And so the whole time you're doing everything, what a gift. I mean, to be able to stand with people while they're going through this and helping them, I mean, it's life-changing, you know. And I was young when I entered it, and I had not a clue what I was getting into. My mom was a nurse, so that was, okay, I'll be a nurse, you know. And what it asked of me along the way, I can, and things like ethical issues, some stuff I haven't even written about yet because I still feel like I should have done more. And I let things happen because I didn't know how to use the right words to get something to change. And point of fact, I didn't have enough power. You know, I mean, if we're really going to get down to it, I might have been able to find better words to use. But in the hierarchy of healthcare, and still today, you've got to muster the troops to be heard if something is going on. So I think that shapes, it probably does shape a lot in what I'm doing, actually. Would I do it again? Would I be a nurse again? In a heartbeat. But I would want to do those close personal things. And what I'm afraid of is that nurses now are being moved away from that, and other people are delivering that kind of intimate care. And I think that's going to change nursing. You know. So. Yes.
You mentioned that you had background in theater, which makes sense after listening to your poem, I'm the Wife. So I really liked how you kind of played the role.
Good,
It's
thank
like
you.
a whole play, you use accent and stuff like that. So I really liked that. But can you like kind of talk about like your role going from like you said to the caregiver from the one who is being taken care of? Like how is that dynamic?
My husband and I, and you're talking about shifting from being the receiving care and then being the caregiver with that. My husband and I talked about it afterwards, and we both decided that that was the worst role, to be the one not sick and trying to take care of the other person. And having not seen them in that kind of fragile, vulnerable position. I became something like a mama lion. And to this day, I'm embarrassed in front of people that I said things to that I probably shouldn't have at the time, but I didn't care because I was afraid of what was happening. And this is an interesting story, and Steve doesn't mind if I talk about it, because here's the thing, I know the end of the story now. That's the other part of it, right? When you're in the story, you don't know how it's going to end. And when he had psychomotor seizures. So with those, you don't lose consciousness, and it's excruciatingly painful, and they couldn't get him to stop, all right? So, and they have to get him to stop because your body can't go through this. I mean, it's just like the muscles are in such spasm that they finally just freeze. But it's just a seizure. And it went down the whole other side of his body from where he had the head injury. And now we're into day 2. And now they're putting so much medication on board that they have to, now they've got him in intensive care, and now they're saying, the intensivist says to me, you and I need to have a conversation about what we're going to do if we need to put him on a vent. And I said, what? Because in my mind, they had moved from, now we're going to use more drugs to control the seizures. Where did the vent come in? And I was, more than anything, I was angry. And I didn't know what to do with it because nobody's going to listen to me anyhow. And I was being difficult, which is one thing you do not want to do with staff in intensive care is to be difficult, because then you don't get to come in at all. Now, this is true, right? I mean, there's not like we're going to punish you and make you stay out in the waiting room. They just don't let you come back. And I was terrified that was going to happen. I had to call my husband's primary physician to come to the hospital where he did not even have practice rights, because I knew they would listen to him. So these are the kinds of things that, I can't put that all in the poem, but I can put some of the poem of what happens to you in that. And can you tell? It was really, really hard for me to do. I've written other things about it, the experience, and my husband remembers almost nothing of this, which is another interesting part, because I have a story, and when he said this, his mother was still with us at the time, and when he was having these seizures, you just stand and like hold him and pat him. You can't do anything, and they're trying to do everything they're doing too, but afterwards he said, you know what the hardest part about those seizures were? And I said, what? He said, I was all alone. He was never alone, but he thought he was alone. And so that keeping that memory of what patients remember or not is pretty sobering. And anything we can do to make that less so, maybe there's no way, with the drugs and all of that going on. But if you can do something about that, I would want to make sure that we did. So, yeah. You're getting a lot of stories. See, they have to be turned into poems because otherwise they sound too, too clinical. And okay. Thank you so much for all coming. This was wonderful.
Thank you so much.
Sure.
This was wonderful to have you here, and thank you all for being here. And please join us outside if you've got any other questions you want to talk to Dr. Haddad about. You're welcome to. And again, thank you so much.